Hey, it's Dr. Jon with Ryan here from Superhuman Lab. We're going to talk to you today a little bit about heel pain.
I'm basically co-host and Brooks isn't here, and we did the Kelly Ripa thing where I pull a straight hand and I jumped in to take over. But yeah, I asked Jon to help or to bring me on to shoot this video because I actually had some heel pain that I had for a long time. I'm a big rucker, which means just carrying heavy stuff for long durations at a time. I started getting this heel pain. We also noticed that with some of our patients that we share and have, that it's really starting to get a lot more prevalent now that spring's coming. A lot more runners out there on the road, a lot from the cold winter, and now it's starting to happen. So Jon's going to kind of explain what exactly is happening and some of the new findings that we're finding with this inflammation or this issue with the Achilles tendon.
All right, so the Achilles tendon is it's the tendon that attaches from the bottom of your heel, your calcaneus, up into your calf or your gastroc. All right, and when you're running and you haven't been running for a while, all that new stress that you're putting on that tendon can irritate it. And as it gets irritated, your body goes in there and tries to clean that tissue up and put down some more collagen fibers and repair in a nice new tendon. But what can happen is if you keep running on it, you end up getting what's known as a tendinopathy, and in most cases actually tendinosis. So Ryan's going to actually take you through some ways to work that soft tissue to help heal that area and rehab it.
And tendon, and just to kind of get the difference and tell me if this is right, tendinitis is basically just the acute inflammation. And tendinosis, are we at the point where they're spending more collagen than they actually have, and it becomes a little more chronic?
Right. And your body just kind of gets stuck in this negative feedback loop or this downward cycle where it can't keep up with this trauma or the stress that you're putting on it from your run, and it just can't clean it up fast enough.
Yeah, it's almost like I went to the bank to buy Guitar Hero, and then I go back and I can't buy Chipotle or something else because I spent it. Spent the cash.
Just guitar.
Spent the
That's all
collagen.
you get.
Yeah. Where are we going over now?
All right. So you're going to do some soft tissue techniques.
Soft tissue. Okay. I'm visual. If you're like me, this is gonna help you out. Simple as possible. When I think about the tendon, it's very taut, right? It's very thick, a big fibrous tendon. And one thing me and Jon talked about is I wouldn't really worry about being too conservative here because one thing we want to do is we want to break up that tissue. We want to start laying down some healthy stuff. So one thing I do is imagine this. This is your heel, by the way. This is your heel. Some people like calling it a heel cord.
Oh,
yeah, it's heel cord. Hold this right here for me, Jon. So this is our Achilles tendon or heel cord if you're from that camp. And one thing I like to do is just come in here and kind of palpate and see which side of the tendon you feel the most tension. Okay, go a little this. I also like to do this in weight bearing because if you do it when it's not weight bearing, if you slacken it, you're not going to get a very good read. So when you're in weight bearing, give it a little feel and just see if one side feels a little taller than the other and start there. I always like to make it very simple and look for this. The areas of greatest tension. So once I feel for a few spots along the tendon or maybe even to one side of the tendon because there may be some other muscles, some of the other flexors of the ankle in this too, I just hone in and hold there. And just kind of do some work and I can do some deep fibrous frictioning, right? I can even shorten it up and strip it out, but just really don't worry about you being too light on it, especially if you're doing your own homework with a lacrosse ball or whatever tool you're working with.
All right, yeah. So some good points are really you can't get too aggressive with this right now. You might cause a little bit of a discomfort, but that's going to be okay. Your body's going to help clean that up and get that thing healing.
Yeah.
Another protocol we like to use is an eccentric load on that Achilles, actually 5 times a week, and we do like 3 sets of 30 is pretty standard. And then Ryan gave me a good one that he likes to use, and it's actually walking backwards slowly. That's going to also make eccentrically load that Achilles, and it's going to build proprioception if you kind of keep your focus forward and you can walk backwards on a clear path to help rehab that. He also had some good points about nutrition. Keep your diet really anti-inflammatory, get good sleep, lots of water, and hopefully we can help get that Achilles cleared up here before too long.
Yep, perfect. I think we got it wrapped up.
All right. Thanks, guys.
Thanks.